I'm Hassan Alosh. I'm an adult joint reconstruction specialist with Michigan Orthopedic Surgeons. It's difficult to identify one particular episode that I find very memorable because after treating thousands of patients, what I find most rewarding about what I do, which is joint replacement and joint reconstruction, is you take folks who are very disabled by their condition and you're able to restore their quality of life. One patient I remember because he came pretty early on in my career was a younger guy who was a chef, and he was a father of 6. And what was so memorable about him is when I asked him who had referred him to me, he told me that the only other physician that he'd ever seen in his life was the one who sent him to me, and that I was the second physician he ever saw. So unfortunately, he had bilateral hip developmental abnormalities. His hips were malformed since birth, and the poor guy had walked through life quite disabled by his arthritic hips, but didn't have the resources to see a physician until he made it into my office. And so we performed bilateral hip replacements on him. He did extraordinarily well, and he went back to working full-time as a chef, being a father to his 6 children in the way that he wanted to be, fully engaged in all of their activities and sporting events. And in many ways, he not only became a friend, but almost an extension of the family. I got to see his kids grow up as I walked him through the recovery process. And for me, it's just a snapshot of what I find so rewarding about total joint replacements. You take patients who really are very limited by their condition, and you're able to restore their function and quality of life and get them back to doing the things they enjoy to do. The way we did joint replacements 10 years ago is radically different from what we do now. And there's been several reasons for this. Part of it is the accelerated rehabilitation protocols that we use. Part of it is the more minimally invasive approaches that we use within joint replacement. Specifically for me, the thing that I'm most excited about is direct anterior hip replacement. So as opposed to traditional hip replacement approaches, which used to detach the major musculature off the hip, with direct anterior hip replacement, you actually go in between a muscle plane and the hip. And we believe that affords patients a faster recovery, less restrictions after surgery, and better pain control afterward. The research is still ongoing, but I think that's one of the more exciting areas in the field of joint replacement. I think MOS has multiple advantages for the community. You've collected some of the best orthopedists in the state, if not in the nation, under one roof. And within orthopedics, there is general orthopedics, and then beyond general orthopedics, there are some people who go on to perform an additional subspecialty, and that requires fellowship training. And so within MOS, you have a cohort of physicians who dedicated that extra year or more of effort to subspecialize in a particular area, in a particular field. And the advantage that offers the patient and offers the community is tertiary level care. So beyond taking care of just the community orthopedics, more complex situations or situations that require a more current and up-to-date understanding of the latest advances within a particular subspecialty are now available. And I really think that's one of the main advantages that MOS has